they're there, and they do what they are supposed to do and what I like to do, have them do. So what can you say?
They were wonderful. They were professional. They treated my father with dignity.
I would recommend Legacy for anyone that needs recovery treatment.
I mean, they just care, you know, they really do. It's not just a job for them. Legacy, I love their emblem because it has that heart in the middle of Legacy, and I think it's exactly what they did for us.
Well, here at Legacy, we provide skilled home health services and skilled hospice services. Home health services are skilled nursing, a physical therapist or therapist, a social worker coming into the home to take care of the needs of an individual there who might have had a recent problem.
I oversee the hospice. We provide cares to people in skilled nursing facilities, assisted living facilities, or their private residences. Hospice is taking care of people that have a limited amount of days left in their life.
Exactly, a good one.
What makes Legacy unique? I know what I expect from my employees, and I know what they expect from themselves. They're very professional, they're very capable, they're very experienced, they're very friendly, they're very outgoing. That's what we expect. We expect people to have a good attitude to go in there. We expect people to not just provide the basic care, but also touch people's lives, to lift their spirits.
At Legacy, we're fortunate to have owners that allow us to meet the individual needs, whether it's they need a nursing visit, a social work visit. They may need a certified nurse's aide 5, 6, 7 times a week. Whatever that is, and for as long as it takes, we'll meet their needs.
We knew that we were going to have to go out and earn our reputation one patient at a time. So some of the first things we looked at said, okay, what can we do that nobody else is doing? So we started taking patients after hours. We started staffing our weekends so we could take patients on the weekends, regardless of the hour, regardless of the problem, regardless of the need.
In 2004, it was recognized that Legacy Hospice could be a good complement to the home health. It allowed people to have a continuity of care so that they can have the same clinicians if they needed it or wanted it.
One patient at a time, little by little, week after week, month after month, we started building a reputation of someone who would go the extra mile.
They do a wonderful job. I wouldn't be afraid to tell them anything problem I had, and I know that they would be there to do whatever they could do to help.
I was well pleased that they knew how to get me well and worked toward that end.
They took care of my family, my mother and myself, and it was easier for us to face what was happening.
The home health care was invaluable to me.
At Legacy, what they did, they had the humor, the kindness to meet Mom where she was, but they also gave her a quality of life to the end.
We built that reputation, and now that's our badge of honor that we wear on our sleeves, is that, you know, we can handle the difficult situation, we can handle difficult patients, we'll work with the physicians, we'll communicate back to them, we'll work with the families, we'll communicate with families on how to best get the best outcome for their family member or their patient. The services that Legacy Home Health provides, every agency that works with is certified by Medicare is required to provide skilled nursing, skilled therapy, social work, and aid. We provide all those services. We have excellent registered nurses, we have licensed practical nurses, we have physical, occupational, speech therapists, we have a social worker, we also have home health aides that go into people's homes to provide assistance with bathing, dressing, activities of daily living. In addition to that, we also have registered dietitians. That's not a Medicare required service, but if we feel that someone has a need, that's one of the things that we'll do extra. We also have a nurse who has a psych background. She will go in and do a consult and work with those individuals to help with the behaviors that someone may be having. Why would somebody choose Legacy? In healthcare, everybody says, would I have my mother or my father receive services there? And we've had a number of referral sources, physicians, hospital people, people in assisted living refer their parents. I have a number of my own staff who refer their parents or their neighbors and those kinds of things. And the reason they do is because they know we will go out there and take care of those people. We will look at every aspect of that person's life that we can address either through therapy, through nursing, through whatever, and they'll know they're going to get a professional, they're going to get a skilled, experienced professional, they're going to come out there with a cheerful attitude, they're going to be friendly, they're going to communicate with them, they're going to do what they can to help that person get better. The key to our success here at Legacy, we hire good people, we take care of those people, we infuse in them an attitude of caring that requires their best. You know, we expect the best, and they expect the best of themselves, and we support them in that.
The reason we've grown and continue to be successful is that having an owner administrator that's also a clinician, being a physical therapist, I think that makes a huge difference. And so he gets just as excited with the patients as we do. When the success stories, he knows the difficulties, the things that we have to overcome with the patients. And so that makes a difference. We all want the same thing.
At Legacy here, we have such a good rapport with patients because we truly do care, and they're good people, and we care about what happens to our patients. I have never had a sense of enjoyment like I do now. To help somebody go from being in a wheelchair to walking within 1 to 2 months, and just the joy and the appreciation in their eyes and on their face is really, really rewarding. And I wouldn't change what I do for anything.
I used to work for Legacy when I was a home health aide, and I then went to nursing school and became a nurse. And once I became a nurse, I decided that I wanted to come back and work for Legacy because I knew that this was a great company to work for. I knew that the people here had high expectations for all their employees, and that patients were our first priority in meeting all their needs.
Well, I recommend Legacy, all right. So I had my knee replaced, and they came right in here and therapy and checked on me and got me going. And so a year later, I had the other knee replaced. And so we've got acquainted with them that way. And that was, well, they took good care of me.
They put every effort to help you. I brought my husband home from the hospital and contacted Legacy to find out if I could have in-home help. And they came out to interview him to see just what his needs were. And it was bathing, dressing, going to the bathroom. They even checked out my bathroom to see if there was anything that I needed to help him. Like, they put bars in the shower, they put bars in the bathroom. The bars were the greatest thing we ever did.
Dad had some challenges. He developed pneumonia. He broke his hip a couple of years ago, and then this last round he had a bout of pneumonia last November. He needed more help, and he wasn't as able to get out and do, go to the doctor. Was difficult for him. He was very short of breath. He was on oxygen, and he had some challenges, and certainly some that I could not meet. It was my first experience with any kind of home health care, and they were wonderful. They were professional. They treated my father with dignity. They spoke in a manner that he could understand. Oftentimes, at his age, he has difficulty processing a lot of information, and that was not the case with them. They were prompt, they were delightful people, and people that you would welcome into your home.
The number one thing is to make sure that that person gets treated well, they're cared for, they get treated with professional care, and that they have a good outcome. Good outcomes can mean different things to different people, but to make sure that we're working to help improve their overall level of care and that they have a better quality of life.